Stroke doesn't always strike suddenly. Sometimes it builds, slowly, quietly, through everyday habits we don't even question. As a brain doctor, I've seen it happen again and again. Good people, loving families, all changed in a moment because of routines they never thought were dangerous. Today, I'm asking you, please, take 7 minutes to learn the truth. These 7 habits may be common, but they are not harmless. And the sooner you stop them, the better chance your brain has to keep protecting you. Every year, strokes change millions of lives, but many of them could have been prevented. The truth is, stroke risk isn't just about genetics or age. It's shaped by everyday choices, habits we repeat without question. This video breaks down 7 common routines that quietly harm your brain and increase your risk of stroke. They may seem minor. Some may even feel like part of normal life. But beneath the surface, they damage blood vessels, raise blood pressure, and set the stage for something life-altering. If you're over 50 or care for someone who is, this message is for you, because protecting your brain starts long before the warning signs appear. High blood pressure, the silent artery killer. Let me start with the habit that scares me the most, because it fools so many people. You see, high blood pressure doesn't hurt. It doesn't make noise. It doesn't even slow you down until it breaks something that can't be fixed. I've met many patients in their 60s and 70s who looked perfectly healthy until a sudden stroke left them unable to speak or walk. And the common thread? They didn't know their blood pressure had been rising for years. When your blood pressure stays high, your arteries take the hit. Inside, the pressure erodes their smooth lining, causing microscopic tears. Your body tries to patch those tears with cholesterol and platelets, and slowly plaque builds up. This is how arteries harden and narrow, including those that feed your brain. If one of those plaques ruptures, a blood clot can form and completely block an artery. That's what we call an ischemic stroke. On the other hand, if a vessel weakens and bursts, that's a hemorrhagic stroke. Both can change your life in seconds. And here's what makes it worse. Some over-the-counter painkillers, like ibuprofen or naproxen, can silently raise your blood pressure even more, especially when used regularly. So what can you do? Start by checking your blood pressure at home, at least twice a week. Write it down, share it with your doctor. Follow the DASH diet, rich in fruits, vegetables, whole grains, and low in salt. If you're on medication, don't skip it, even if you feel fine. That's the trick high blood pressure plays. It lets you feel fine while it damages your brain. A major study from the Framingham Heart Study confirmed, the higher your blood pressure, the higher your risk of stroke, even if you feel completely normal. So if you take away just one thing today, let it be this. Check your blood pressure, share your numbers, protect your brain. Smoking, the habit that ages your brain. Let's talk about a habit that many people still underestimate, even after decades of warning labels. I've met patients who tell me, "Doc, I only smoke a few cigarettes a day. That's gotta be better than being a heavy smoker, right?" And I always answer with a sigh, because the truth is, even one cigarette can start the damage. Smoking sends thousands of harmful chemicals into your bloodstream. Chemicals that don't just stay in your lungs, they travel through your arteries, including those leading to your brain. Here's what happens next. Your blood vessels stiffen and narrow, making it harder for blood to reach your brain. Your blood becomes stickier, increasing the risk of clots that can block a brain artery. Your blood pressure rises every time you inhale nicotine. And oxygen, it drops, leaving your brain undersupplied and overstressed. This is why the CDC reports that smoking doubles or even quadruples your risk of stroke. And it doesn't matter how old you are or how long you've smoked. The damage adds up, but so does recovery. The moment you stop smoking, your body begins to heal. Within 20 minutes, your heart rate and blood pressure begin to drop. Within weeks, your blood vessels start to relax. And after just a few years, your risk of stroke can fall to nearly that of a non-smoker. So what can you do? Start by believing it's not too late. You're not too old. Many older adults have successfully quit with help from support groups, nicotine patches, or medications. Talk to your doctor. Ask about a plan that fits your life and your history. As one former smoker in her 70s told me, "I never thought I'd quit after 40 years, but once I did, I felt like I had bought time back for my brain." You can do the same.
NSAIDs, painkillers with a hidden price. Let's talk about something that sits in most people's medicine cabinets: painkillers. They're easy to buy, they work fast, and for many older adults, they feel like a daily essential. But some pain relief comes at a cost you might not see until it's too late. I'm talking about NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, Advil, naproxen, Aleve, and others. They're everywhere, but used too often or combined the wrong way, they can quietly raise your stroke risk. Here's how it works. NSAIDs can raise your blood pressure, sometimes just a few points, but enough to push you into dangerous territory, especially if you already have borderline hypertension. They can also affect how your blood clots, increasing the risk of ischemic strokes, those caused by a blocked artery in your brain. And if you're taking low-dose aspirin to protect your heart or brain, adding other NSAIDs without medical advice can cancel out the benefits, or worse, cause harm. A 2017 review in JAMA Cardiology found that long-term NSAID use significantly raises the risk of major cardiovascular events, including strokes, especially in older adults with existing risk factors. But here's the hard part. Most people take NSAIDs without thinking twice. Some use them daily for arthritis or chronic pain, and they rarely tell their doctor because they assume it's harmless. So here's what I recommend. Keep a medication list, including over-the-counter drugs, and share it with your doctor at every visit. Ask your doctor if your pain plan is still the safest one, especially if you're over 60 or have high blood pressure, heart disease, or diabetes. Explore other pain management tools, gentle movement, physical therapy, anti-inflammatory foods, or acetaminophen, if appropriate for you. One patient told me, "I didn't know ibuprofen could affect my heart. I was taking it like candy." Please, don't let convenience become a trap. Pain relief should never come at the cost of your brain.
Before we move on, now if any of these habits felt familiar, you're not alone. Millions of older adults struggle with these same routines, not out of carelessness, but because no one ever explained the hidden cost. But here's the good news. It's never too late to change direction. You've already taken the first step by learning. Let's keep going, because what you do next could protect your brain for years to come. Diabetes, the risk multiplier you can't ignore. I've seen it too many times. A patient comes in with well-managed diabetes, or so they think. They're not checking their sugar regularly. They've skipped a few doctor visits. And then one day, they wake up in the hospital, unable to speak or move one side of their body. What happened? Diabetes doesn't just affect your sugar. Over time, high blood sugar quietly damages the blood vessels that carry oxygen to your brain. It thickens artery walls, making them less flexible. It encourages plaque buildup, blocking blood flow. It makes your blood more likely to clot, leading to ischemic stroke. And it often brings along high blood pressure and high cholesterol, a dangerous trio for your brain. The risk isn't small. People with diabetes are 1.5 times more likely to have a stroke than those without it. And worse, many strokes in diabetics are more severe, with slower recovery. But here's the hopeful part. Managing your blood sugar really works. A study published in Nutrients 2020 found that strict glucose control in older adults significantly reduces the risk of stroke and cognitive decline. So what can you do? Monitor your A1C every few months. Eat in a way that supports your brain. Fewer processed carbs, more fiber, healthy fats, and lean protein. Move daily. Even light walking helps your body use insulin better. And stay consistent with your meds. Skipping them because you feel okay can lead to the exact moment you never saw coming. A man in his late 60s once told me after his stroke, "I took care of everything except my diabetes. I didn't realize I was gambling with my brain." Don't let that be your story. Take your sugar seriously, not just for your heart, but for your future memory, your speech, and your independence.
Sedentary lifestyle, when stillness becomes a threat. It's easy to sit, and the older we get, the more tempting it becomes to rest, to take it slow, to avoid pain or fatigue. But here's the danger. Our bodies were made to move, and when we don't, the damage doesn't stay in our legs or our waistline. It reaches all the way to our brain. Lack of movement contributes to weight gain, which increases stroke risk. It worsens blood pressure, raises bad cholesterol, and affects blood sugar regulation, a perfect storm. And perhaps most dangerously, it causes our blood vessels to lose flexibility, making them more prone to damage and clots. Even small amounts of daily activity, just 20 to 30 minutes, can dramatically reduce stroke risk. The American Stroke Association reports that physical inactivity is linked to a 25 to 30% higher risk of stroke. But they also say it's never too late to start moving again. So what can you do? Choose gentle, enjoyable movement. Walking, stretching, gardening. Start small. 5 minutes a day is better than 0. And build from there. Let motion become a habit, not a chore. My patient in her late 70s told me, "I started dancing again, not like I used to, but enough to make my blood smile." Your brain needs that smile too. Too much sugar and salt. Hidden dangers on your plate. Most people don't realize what's really on their plate. Sure, we avoid obvious sugar, cookies, candy, soda. But what about the sweet tea, the fruit-flavored yogurt, the cereal that looks healthy but isn't? And salt? It's hiding in canned soups, deli meats, frozen dinners, foods we trust because they're fast and easy. Here's what sugar and salt do to your brain. Sugar leads to weight gain, type 2 diabetes, and inflammation, all stroke risks. Salt causes fluid retention and high blood pressure, the #1 cause of both ischemic and hemorrhagic strokes. Together, they can make your arteries stiff, narrow, and inflamed, cutting off the oxygen your brain needs. A study in Circulation Research found that high sugar and sodium diets accelerate vascular aging, even in people with normal weight. So what can you do? Read nutrition labels. Get to know the added sugars and sodium counts. Aim for under 1,500 milligrams of sodium per day if you're over 60. Choose natural over packaged. Cook at home when you can. And swap sugar with fruit, salt with herbs, flavor with care. A retired teacher once told me, "Once I saw what was in my favorite healthy soup, I stopped trusting the front label." Trust your brain. Read the back.
Not drinking enough water. The forgotten stroke risk. This might surprise you. One of the simplest things you can do for your brain, many people forget every day.
Water. Dehydration doesn't just cause dry skin or dizziness. It makes your blood thicker, harder to pump, more likely to clot. This raises the risk of ischemic stroke, the kind caused by a blocked artery. It can also lead to low blood pressure episodes, especially in older adults, which reduce blood flow to the brain. And here's the catch. Thirst becomes less reliable as we age. You might be dehydrated and not feel it until something goes wrong. The National Academy of Medicine recommends around 13 cups for men and 9 cups for women daily, including fluids from food. So what can you do? Carry a water bottle, even if you're at home. Sip steadily through the day, not just during meals. Add lemon, mint, or cucumber if it helps you enjoy it more. Idea. One woman in her 60s told me, "I didn't think water mattered until my doctor showed me what thick blood looks like." Let your blood flow freely. Your brain will thank you with clarity, energy, and protection. Let's be honest. Some of these habits might feel familiar. Maybe you've lived with them for years. Maybe no one ever told you they could harm your brain. But here's what matters most. You're watching this. You're learning. You're here. And that means something. Because strokes aren't always random. They often come after years of small, silent signals. Signals we missed or misunderstood. But you're not helpless. Every small change you make, drinking more water, walking a little more, checking your blood pressure, is a message to your brain. I'm still here. I still care. So here's what I invite you to do next. Share this video with someone you love. Leave a comment. Which habit surprised you the most? And don't forget to subscribe, because next week we'll talk about early stroke warning signs that most people ignore until it's too late. This isn't just about preventing stroke. It's about protecting your memories, your words, your smile, your life. Take care of your brain. It's taken care of you for decades.